Mr. Mankwa. Me offer was a niska bani de awie ni project no. Eso de bia me offer sika ma ne wo problem.
Enemremu. Na monte tap sending kan.
No so ne de.
Tap send ye easy, fast and secured way. Ubetimi send this free amanone. Aba Ghana bank account and as a mobile money account. Untia transfer fee bia.
Sir, I obey any say.
Chine say won call App Store na Play Store. On download the tap send app no. Or download ya. Ebebu sanso promo code. Oma the pet TV shim. Obenya €5, £5, and answer $10 on his first transfer.
And you make kwa friend a catch them.
Tabi minyanwe. Esansa tap send at the good news aba. Tap send the the customers won't or the tap send wallet aba.
I know about any say.
So your customer who you cases here. Ubetimi akọ tap send app no create wallet woso. Enti se rate ne kosora now the sika ko gu wallet no. Anase mpo betimi atosusu nkakra enti abre sema opeso send sika ba Ghana no anse wa send sika na ba Ghana anase oba o my Ghana mu watimi ya yusu sika e wo wallet no tie
and you said to say you yusu momo Ghana hey no
sa pepe se si tap send that trena shim kopiem wo United Arab Emirates, Netherlands and Austria. Tap send na papa no.
After successfully redefining Accra's skyline with the delivery of the signature apartment, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana, offering a first look of Sultan Sky. Sultan Sky, a magnificent representation of the seamless fusion of quality, groundbreaking innovation, and pioneering architectural brilliance. An extraordinary structure set to reshape the concept of upscale living, thanks to its inventive attributes and unparalleled commitment to precision. This master-planned residential development will focus on the building's location, security, privacy, the design's aesthetic brilliance, elevated features in each living space, cutting-edge smart home technology, and amenities beyond imagination, with fantastic residential features which include 24-hour concierge service, a state-of-the-art fitness center, a floating tennis court, a floating swimming pool, a spa, a sky pool, a sky lounge, a movie theater, co-working spaces, kids zone, distinctive lifts for staff and deliveries, private gardens, chef's kitchen, expansive terraces, entertainment rooms, restaurant, and 24-hour security. Sultan Sky, a new perspective in the sky.
Hello, this is Lawyer Wisdom of Wismart Solicitors. Join me this and every Friday on OT TV from 8 to 9 p.m. for all your UK immigration matters. I hope to see you there. Thank you.
A very good evening and welcome to your Thursday edition of Time with Tap Send with your servant Nana Kwame Osei-Tutu. And enyumre menu eshia na ejumekuo bi adaroma ena asomimu ema mitimi edi dwumadie ebro baby bia obia eniti mamefa aseda kese emfa ema Tap Send ejumekuo no se abreni nyina no okita mi mu ema mitimi ede dwumadie ede ebrewo baby bia wo ewo wiasa fa na nyina wonso a ena anwumre wa ba beka ho meda wase se enso nka be nioma bebre ho nom a lot of TV programs are on your channels and so we decided say we be joining on this platform yeda wase se motimi aba beka ho sanso ena media se that can say me two guests are on aba beka me ho this evening in fact it was on a short notice, but I really appreciate them for accepting to come and share their knowledge and their experience with us. In fact, many Dr. Kodzo Asia and Ra na and Simbi Okayen and then I hear me there and I'm and say and can only Dr. Mustapha Omoni MHSA and Semno. Na adia ba kwa mi busaya Dr. Kodzo am peneso ene minya ho kwa mese buse bi na ma se ne obesi na adwen. So we'll be talking a bit more about women health. But aside that, and so generally our two doctors are doctors such as cover a wide area when it comes to medical field, or any general question be when it comes to health and so edu question time and no so they are more than happy to accept all those questions. But before that, my main call a year tap send us na main call share any update or more at the MIA and na fe and me two young and dynamic doctors at the abroad na yeniomo action and come on women health. Yo, Ora Kofi Frimpong, a growth manager UK and Europe. Kofi Memoajo Emoakwaba eba a time with tap send Jumadi so enumerate.
Nakwa mpacho meje so. Pacho ene de otimen kantem de.
Meto nka papa minim se ebia ene no ufiewura waso internet na mountain ebia esebos me aso wetua rent. Enti ufiewura waso internet na mountain.
Tap send customers inti de na nakwa me yemu wiase inti. Abusi afọ Mpacho, good evening. Chia obi bia our platform so invite obi na ombra, even though it's about women health, but sebi yene man etifie enti no be masuba bitia ade ni si a utimi esua na obo nipa no enti mesre wa uti show iso a I think we are about 37 people, at least obi ankofa ba komra ye double number no mesre mo a yenye ne sa. And then I am ready from the quarters of tap send. Still na ye the wallet na ye bo hu the ro and ye boy rate ne so hu the ro pa. Rate ne the eja wom because ye hu say month no. I see tomorrow is the last day of the month and people are getting paid from today and then tomorrow. And you be making sure say on all front rate ne the papa no. Tap send the bell and be rest assured say any ochina there still na rate papa fee we and I pay me was and I'm who pushing this case yes rate mu Jonathan so now say hey no so ne there Ghana for and you ever cause one ama your customers the best rate tinana kwa when you made them buy our rate who asem nam the buy say and then ochina there we are closing the month with great rate for our customers.
Yo, Kofi yebeda se mejiri se chiri no se obi ewo question bia na edu tap send focus section a omo ede beba na yetimi ayi omo ano eni nti anwumre yeda se wa ba kan ho ewo dwumadie so
doctors ye mama kwaba so se mo agepenie na mabasem ba beboa ye customers nyame hira mo na mo nkyerɛkyerɛ ne omamu ye na se ne omo ye young boys ne adwuma omo ye no na me ntia ba de me wa kyerɛ me Kofi, tenase, na train, obetiasie, and we are talking about women health. Anka wonim se doctor ba ko no oba bi no. Onse ke hona nka me wo.
Takosia, hona wo.
No senia. Your men are former bus of system, but you are wish you all the best.
All right, go be say ene dwumadi e beboa pa enti bomodi anya wo nko a fra wo yire no metena wo nchen na muntie bi ene anwumre yo abusua forma men dane me ho eno na chi no mede eye Dr. Kodzo Asamany ene Dr. Mustapha ebebro na ya twetwe enkomo producer bacho mame two commercials na fe eno na chi me fa Dr. Simbra.
Okay, hello. I would like to take this opportunity to congratulate Tap for a wonderful job so far. I've been a customer for TapTap for the past 2 years, and I'm really enjoying it. Lately, I met A-Class Photography, and we had a good chat. He introduced me to the wallet. As I'm speaking to you now, I've got 5,000 in my wallet. So what happens is, if the rates go down, I still have that money locked up in my wallet. So I don't need to worry about the rate. Whether the rate is going up or is going down, I don't need to worry about it. I have it locked up in my wallet, and I can go to the wallet and send it anytime that I want. So I'm introducing it to you. I hope TapTap is going to keep up the good work. If possible, later in the year, transfer from TapTap to TapTap. We're looking forward to that. So hopefully we could get to that point. But for now, I'd like to say thank you for TapTap for the wonderful work they're doing so far, and we hope they continue to give us a good service review and offering for us all this while. Thank you so much, TapTap.
TapTap said, oh, I was my baby, you're from Calabos, the only boss. With oneness, baby, I will be everywhere I day and everywhere they go. TapTap Send got me covered. If you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through TapTap Send. And guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download TapTap Send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download TapTap Send. Okay? But also, when I receive my money, the other tell the world with channel, like my view, no, hey, you crazy.
Download TapTap Send now on Google Play and App Store. TapTap Send. It's secure, convenient, easy, and fast.
Hello, this is Lawyer Wisdom of Wismart Solicitors. Join me this and every Friday on OT TV from 8 to 9 p.m. for all your UK immigration matters. I hope to see you there. Thank you.
Yo, I was here for Sabri, Ebra, do say, me two guests, my two medical doctors, Eddie Ebrewo, said they they are very young, dynamic doctors, and in Ray, or money, Baba Tutri, and Como Afa Women Health. Maybe I see Eddie free Dr. Kodzo Asamany. Doc, you know, I share our platform, so, but not on this show. Nyame se pass and then you wama ho kwan se ani emetwetwe enkomo sa enso na Dr. Mustapha yebeda mama me fan free Dr. Asamany. Doc but obetimi introduce ho akakra e de a kire na afei ya twetwe enkomo.
Okay, thank you very much. Pacho me de chi ne bro for no. Fafra.
You are permitted to do so.
Thank you very much. All right. My name is Dr. Kodzo Asamany. I'm a medical doctor, and currently I'm furthering my education because maybe some come in na who edumedi bi na yenenge kan because sometimes if you original baby fa konenge kan and so we evolve in our upgrade and all of that. So I'm a Ghanaian, of course, and I'm currently everywhere, so you can't find me at one location because of schooling and all of that. So I'm glad to be here today, and it's an honor to always be present at this program, your platform, and I hope that we enjoy this show tonight. Thank you.
Thank you, Doc. Now, Doc, but your specialty, medical field, na fasa.
But your manager of Sengaino.
Oh, okay. Intina just say common no. Na just say udim pepe yo me da say nya wotrema. Mama ko Dr. Mustapha. Doc, me ma wajo ena nwumre enso mo akwaba eba jimedie so. Yo, where the kakra bi na ye ka say Dr. Mustapha on ne hwan ya.
Okay, sana kujoka ya. You be mix bibia kakra.
Yeah. Fra. Doc, Mr. Wo, we there, o can ye be miss no me ma me fa we entwam. And I know me church member bi efri mu na ye kwa ye kakra. Na abrante baako odu ho no mo ye car boot sale. Me car boot sale e we yi ase a na je say emrante bi no mo bi o car boot e no omo fra ensa. Omo fra ensa. Na abrante na okoka mo no. Onimo mo baby na okọ join him within 5 minutes na afi nani so ayi tum no ngu baby onam enti we die enye de ye de fra de bi no e na ye kan wa
enye no bia I'm also a medical doctor. CCI may practice I was Switzerland as a family physician. Me interest in me a lot of interest in obs and gynecology in the way there. Food media about family, no send a to me manage the health of a person. But before Hano, I say I got me program with Ghanaians. The first question I maybe say, hey, I'm gonna afford me 3 new idea, man, anything. Because Ghana's over 3 media, when your doctor, which is a BP.
Rasta doctor.
I wait, but how to put do man on your couldn't say, yeah, but Ghanaian program, I see, mommy, because by all means, remember, I'm a program we are. Dear Mamma audio CC, I say, no dreaming, it's not your so regular Dr. That is Dr. Mustapha.
Nice one. Yo, any very free Dr. Kodzo. Doc, Mami Mamo 2020. Na yemma kwainan kofom busa questions. Na mijiri say more questions neighbor, you have the opportunity to talk more when it comes to women health. Yo, Doc, Mami very free Dr. Kodzo. Sir, ye can a man pomudin semwa. Hinfa and I will be focusing on and then you any akasa.
Okay, a women's health. I mean, generally, I have this notion, say, my society and answer be in the community in United. So more, if they are fit, if they are healthy, it helps each and every one of us, because without women, I mean, there's a lot that we can actually do. So we give the respect and we appreciate the women in our lives, from our mothers, our aunties, our partners, and all of that. Today, we focus about the physical aspect, the mental aspect, the social and the sexual aspect of women's health. And I'll start with the what's it called? Common health concerns. Normally, women have reproductive health issues. Most of the times, you have a lot of women complaining. They come in with breast cancer, mental health disorders, cardiovascular disease, and any account be. But there are certain things we really don't pay attention to, like the sexual part and then the mental health part. And baby, a year free banner. We feel that some of these things we are not supposed to touch on it, but it is very, very important. Africa is one continent where we don't really pay attention to mental health, and I am not a hard dream baby. And then also, it is very difficult for us to talk about the topic sex, because sometimes, I don't know, I feel that we don't have a proper way of actually bringing our women or like our little ones to understand the topic about sex. But it is very important for us to pay attention to. I'll move on to our reproductive health. The reproductive health, some of the importance of reproductive health for women, it involves a range of issues, including family planning, pregnancy care, prevention of sexually transmitted infections. So, Sabe, Oko, yafa Ghana, na so Oko yen crass in the bebre na. Yetimus a man for bebre, or move bebre. Meanwhile, so they are not able to take care of them. And then account. So we advise, we teach them on family planning. When you walk into any hospital and then you want to acquire knowledge about family planning, it is very necessary, because you really need to have a plan. Because maybe you might not be able to even take care of them. And then and then most of the time, so
they take up from our mothers. It's me mommy do stage where you will say in a day, me submit my. We are not saying if you can, it's okay, but we feel say you really don't have to overpopulate it when you are not capable of actually taking care of them. Pregnancy care. I once worked in one district hospital, and can you imagine say oba fa nyin say na awo aka no oba hospital no otimoto so any other neighbor. It is very necessary say you get to know the pregnancy care routine when you are pregnant from the time I won't say you go to the hospital, you take your necessary medications and then all that. Then prevention of sexually transmitted infections. Ayana sometimes Ayana say we normally yes sure the younger ones need sure the younger ones more than the infections, you know, which I feel say I don't know why what it is about because it feels say any more here in Mguasiebia and ACBBs, but infection it's a big deal because what mean infection be on the ma mean to once be on grandpa you drew. I mean we know some of them sabe HIV AIDS and account. Imagine say who protect home from some of these things are there. I mean that you can live longer, but then for you to get pregnant and then give birth, I think it is way a better option as compared to the infections. So when it comes to the family planning now, you have access. Everyone has access to contraception and then family planning services anywhere that you would actually go to. The only thing they have to do is that just walk into the hospital, talk to a doctor. They will refer you if it is necessary to see a specialist. They will refer you and then they will take you through it. We have different types which you can choose. They will feel say be a baby, then you go ahead. The maternal health care and then pregnancy related issues. So be one or chronic diseases be to say hypertension and diabetes. Patrol say and you are pregnant. Sometimes you group you into the high risk pregnancy group because a lot can actually happen if you're not managing your hypertension and then diabetes very well. It can affect you, the mother, and then affect the unborn child too. So some of these things, and it is very necessary if you have it, you go to the hospital when you are pregnant from the onset. Even when they are taking the history now, these are some of the things that they will probably be asking you. So we boost you, it may be say we boost you. Beyond my we boost you, munibi. But we find you say na it me ba. And also honum. So you should share some investigations soon nana. You're making sure that throughout your pregnancy care, your maternal health care, and your pregnancy, I'll move on to the breast health. It is very important. Say, you share breast health. We talk about breast health awareness. I know, say, I need to raise awareness, but sometimes we don't really pay attention to it. But it is very sad. Say, it is very common back home. In Ghana, like breast cancer is very common. We don't pay attention to it. So we advise early detection of breast cancer through regular screening can significantly improve treatment outcomes and then survival rate because amount for baby with these. In Ghana, no, I think the mammogram is done at the age of 35 and above. And it's very important. I mean, at a younger age, we don't really advise it. But then as time goes on, it's very necessary for you to check some of these things. Clinical breast exams and breast self-exams. Sometimes during breast cancer awareness, there are lots of videos. When you go to a lot of platforms, even when you Google it, you can actually go, you can see the outline of it. You can see how you can actually check your breast. Say, sorry, what don't suffer no say you have something, you feel say lamp bia be mana se bibisa internal so ko hospital utimu say bia sebe onepo no a change color and then can na se bibisa there's some slight different be then you move ahead like you just go to the hospital. It is very necessary as a man ukuno what are hearing chain maybe probably sebe true sexual intercourse. When you people are doing your own thing, you notice something, you just draw her attention, maybe your own, but say a year with the end, you have to actually pay attention to it. When you before for now, I just prompt her she should go to the hospital. And there are lots of support and resources for breast health, just that we don't pay attention to them. We feel say, oh, we be but say, oh, we busu emu a utiminya. And I'm a patron, no. it's highly possible so also bit mania breast cancer. It is very rare, but it is very possible so bit mania. When it comes to mental health, this is the part where I feel that we don't pay much attention to it because ye buy any go nyama bebre so ya share ye ho den and na bia wa bre crampo a u feel say bia obetima because ye na nanom ye with that ye na nom time it's not like the way we are right now. We are exposed to different things. Our environments, we are exposed to harmful hazardous substances and then toxic substances we can actually affect our health. And I feel say when we get tired, sometimes we have anxiety problems, depression, we can't even sleep, and we are not having enough rest. And then some of these things we feel say normal body not break, but it can actually push you to the extreme where you can start having mental health disorders into a bit to honor or to one of my bones why or kasachin we feel say a normal or not. It is not. Sometimes the person is really tired, but we push them. So about what sorry and part ebia obed nyan kra ne duane ansa na ebia okunu duane wa ba benwa na wan kasa wa dress so ho ansa na wa ko edwuma. You have to come back home early and then come and prepare for the family again. Then you have to settle everything. Then later on in the evening you go and then sleep, you wake up and then you repeat these things. To be told ayana e hard drain ti me pacho me nuanom me ma me papa no mo amoa no obani wura kitchen and we wura ho on radio no announce wo room say bia mo ye young couple like you start practicing some of these things because a man your machine or me nipa or more bread they might probably not say because of some of the notions that we have from the past say a man dear ebia say no more it is not like that and ni say yes sir because it really affects them mentally. And then I think say minya downphobia on my friend I think brother Jonas no can say ne maame also say ebia sometimes or on man on no kasa na make joke you say hey you're having meeting one honing the count. It could be funny and then she might not have a problem but deep down within or the ashenimu and then she feels say bia oh enya but deep down within it can probably affect them. Trauma, domestic violence, and socio-economic factors can also contribute to mental health. Sika ho edin, yenim say economy ni basa ene nkeka ho. Sika mbefia e mind na mind den. Oko ware na say busua ne maybe asika sem of forma. Don't take it like slightly crap because it can actually put a toll on the woman because sometimes it's imika so ba kwa ware or he say be man no hefa na obetimi dem akọ after we were our anyway be an BBC nigga can or no if you want to mean you have a supportive wife but sometimes you can tell say they are really going through it and some of these things affect them in various ways. During pregnancy can affect them during so also menstruation like I said domestic violence maybe the way who an asset trauma and as bibisa ya boa korana and as bibisa no it can affect them during their menstruation. It can actually affect them during their menopausal stages. So we have to really pay attention to some of these mental health. When I open the questions, I mean, you can ask some of the things we can actually do to curb some of these things. And also, there's a stigma and then barriers to seeking mental health support. The biase ye share your so be anye bibia oh but when you go me patro wabre untiminya emobian for so truth to be told I mean when you are tired you don't have to push yourself because at the end of the day it's really going to affect you me patro me ma me no name man so me nka so push be man na ono so be man so timi bre because ono so pia bontina so no ko page my and not discard before they also go through a lot. Sometimes the men don't really talk about it, but it's rather unfortunate that we are not talking about men's health, but we are talking about the women. So just know, say, whatever that is bad for you, it is so bad for the men. So we have to actually have a balanced life so that it can actually help each and every one of us. Nutrition and physical activities. The role of nutrition and exercise in women. Sometimes, yeah, man, baby, I'm exercise. Yeah, mammy, no more pet, seven, medium sell mammy or shems here, mammy on exercise. But they be all because an infant, you see, and no sorry, and I say, mammy, I'm sorry, but that's all for exercise, ni serious. I mean, if you say be on anti free exercise, that's not the kind of exercise that we are actually talking about. Time and when you start, your body adapts to what your body is doing. So you realize that your physical activity, you take you walk, it be a 30 minutes walk, now walk over. It is very necessary. But some of our mothers, the women around us, they feel say rounds no year and also the working that she does, maybe a may feel or Nancy Kwan, but Ophelia said that is it. But you really have to step out, get fresh air, step out into the street, walk for a while, and then come back. It is very necessary. It is not just for mental health, but then again, it actually reduces the risk of chronic diseases such as obesity, diabetes, and then heart diseases. It's very key. Also, we move on to the sexual and reproductive rights. This is a topic because sometimes it's very sensitive where we don't normally talk about, but understanding sexual health is very important. First of all, let's take it from physical health. It is very necessary, say, Obabia, you will have a little bit of knowledge, not in depth, the female anatomy, like Obanisini is like Sina, Wusitiano, Osho, Wasiso anase wasisebe wasiso anase eso anase bibisa. It is very necessary for you to know some of these things so that it will help you recognize any abnormalities, changes be anase bibisa, which can indicate any underlying health issues. Regular gynecological exams, including pap smears and pelvic exams, it is very necessary and essential for detecting conditions such as cervical cancer, sexually transmitted infection, and reproductive disorders. It is very necessary. If you go in for routine checkup, you'll get to know some of these things. Then again, understanding under the sexual health, emotional and mental health. Emotional and mental health plays a significant role in sexual health in the sense stress, anxiety, depression, trauma, any relationship issues can affect a woman's sexual desires. So Obani Ninja, truth to be told, she will never be satisfied when you are having sex with her. Arousal, but something of that sort. The only thing on himself be out in the or the honum keke, but she will never enjoy it. But that is not how it's supposed to be. It's supposed to be both ways. Two people coming together to enjoy what is actually going on. We shouldn't be selfish enough, but we should also think about them. So having the woman in a depressive state, the woman being anxious, it is very key. It plays a significant role in their sexual health. Overall sexual function, it actually affects them. So addressing some of these mental concerns and then seeking therapy and as a counseling can improve the sexual well-being. Let's come to social well-being, where healthy relationship and an effective communication are fundamental for sexual health. What do I mean by that? Building and then maintaining healthy relationships involves clear, honest communication and sexual desires, boundaries, and then consent. Sometimes you probably in your courting days, you really have to be open and then have a clear conversations with them. This is what I'm used to. This is what I'm not used to. I deal with them in here. Maybe I deal with them in here. These are my boundaries. There are certain things I cannot do with any account. It is very important because society, our attitude towards sexuality, our cultural norms, and our media representation can actually influence individuals. Obi timi ko hu video bi wo baby na opeso obe practice. Pacho onye actor. Sango for no professionals is not something you are supposed to bring into. If nipa calling to me nya pacho, don't force it on the person. Some of these things cramp drew and account not bema wakako fe drew now the abisi obi baso na pine it is way out of the way. Like the person will never enjoy it, and then it boils back to the fact that this person can actually have traumatic experience and it's not really going to help the person. It is sometimes so you can see it could be that extreme so when you before whatever the person might probably do, she will never be satisfied with it. Into what I was saying, which is not good. So it is very necessary to have an honest and an open conversation with your partner to know. Secondly, sexually transmitted infections. Like I said, it is very key. I always say, when you meet someone and then you are in a relationship with the person, as a woman, the first question you should probably ask the person, they say, if you really want to settle with the person, why don't you go for hospital for checkup? It is way important that ejuma be na oye. Because say ejuma na me no, let's say I have an isabi, nipakono infection, it be a HIV, and the person is working all right. And at the end of the day, you come in touch with the person and then you have a sexual intercourse. Or the amount of money the person have cannot cure you. And it's very important that these are some of the things, I mean, from an early stage, the younger ones here, start taking the person to the hospital. You people should run the necessary checks and then see if both of you are clean before you start even thinking about other things. That is if you people want to be together. There are issues too. There could be sexual dysfunctions. And these sexual dysfunction, the common types where you can find is hypoactive sexual desire disorder. That is low libido. And also, it's a problem. If you don't understand the person, maybe you'll be throwing tantrums and all that. But no, you are supposed to help the person. You take the person to the hospital. The person will seek medical care, and then something can be done about it. Female sexual arousal disorder. That's difficulty to get the person to be aroused. It's also there. Their inability to achieve orgasm. I realized that yetimisha videos binebia nipa kona ye bibini epese practices hard in pacho ono so want to say nyesa na yebo no. That every woman is different. Some people can do it, some people cannot do it. So some of the things that you actually see, you don't have to impose it on people. Causes of some of these sexual dysfunction, it has various causes, including physical factors, hormonal imbalances. It could be medical condition. It could be some medications that they are on. Psychological factors, stress, anxiety, depression, like I've said. So there are medications that we can actually do. So if it is hormonal disorders, they can actually do hormone therapy. You can get antidepressants. Your lifestyle changes and everything. It is very important. Now, the last one, menopause. Yesterday we were talking about menopause, and I said, during menopause, it's a natural transition where women go through, and we really need to respect them for that, just like they go through pregnancy, because that time they have hormone fluctuations. Hormones in here be into time maybe you have to understand. If you understand it's a natural transition that they go through, you would understand how you would actually go through it, because they need care, they need affection. All these things. Sometimes it's me but still they are not satisfied. It is not and more pain or more and the thing is actually happening in within, and there is nothing you can actually do about it. So if you have agreed to be with the person for better or for worse, and the person is going through some of these, because mind you, if you were a man and then you are sick on the hospital bed at your old age, because I've seen some of these things where the man is lying on the hospital bed and the man is probably dying. The woman will be there, sit there, take care of when it gets to their turn, we should return that same favor and then do it like that, because it is very necessary. They need us from the start to the finish. It's more like a race, so they need our support. So we say it's a menopause, sometimes the age range is around 45 to 55. It could be earlier, it could be way than that. So it marks the end of a woman's menstrual period. And there's a decline in a hormone called estrogen levels. This estrogen, the moment it declines, it causes a whole lot of things. You can start having hot flashes, night sweats, mood changes, and vaginal dryness. And I'm going to say, because I was like, vaginal dryness and they drew on when then you are having sexual intercourse, there's a friction, you can actually hurt them. It's not anti-comfort, so I say water-based lubricants, KY gel, any account. Invest in these ones. And I think say and business so basically you see baby oil, and I'm saying, some of these things are for the outer skin. And I feel they contain some chemicals that is not actually good, because you're actually going inside, and women are prone to a lot of infection. So some of these things are supposed to be paid attention to. These water-based lubricants, and I'm sure you'll be up flavor or different flavors. So invest in them and then buy these things, and it can actually help them. Treatment and managing wise, the moment you realize you are hitting your menopause, we have 3 stages: menopause, and then the post-menopause. Or to track said this is what is that. They will just manage the symptoms. There's not much that they can do. So they will manage the symptoms. When you need hormone therapy, they will give you, but it have its risk and then count. So I'll just wrap it here so that if there is any questions, or maybe Dr. Mustapha will also add his, then we can all take the questions together anyway, Biano. Thank you very much.
Thank you, Dr. Dr. Mustapha. Bachofa also the account and my enough a manco for kind of umbusa questions.
Could you draw my pressure at me? Anyways, basically, it's a winner first speech, you know, yeah, you wait, you to make a poker cracker. In the moment, basically, he said almost everything that is necessary. I made a back on his say, because saying, then let's understand the importance of which. In the sense, Nana, Mr. Odin, Nana Kwame. Since on our idea, may use who as obey speaker of the others. In the Nana Kwame, first question, let's say. I didn't tell Dr. Starker say you lose weight. I didn't tell now if you say almost talking about loss of weight every time. I didn't tell now didn't say important.
Me MOT alas be me koye na chese se unya waiter it me ema unya other health conditions be to say me say obesity and in ye keke ho enti no me say kura no ye share me say anopa bia na say a day bia me nko walk about 1 hour na omo hwe me ya again more weight enti they say the eja akwakura me sorry ana me ko walk kakra
Nice one. And then I'll come into the woman a little bit. Imagine say I don't know say nkrofobinima normally say oba elusu weight ni body sizes nyama bi sulu se nyama bi be ma no tape no enu sulu see for example even say doctor catch you say ulusu ni weight wow nim say but unim say lose weight no hips no ebeko eto no so beko. What is your take on it? What do you saying? Would you open say nyama we nyina beko ana say what the anka say be we more important saying loss of weight no now.
Wo share dia say oba ewo ahoden na otiasea eno will be better than so benya health conditions have you can enjoy her again. And I believe yes. And say me di mani ko gina to na ye you know na just na when you have conditions I can enjoy her again. Yeah. I think so. Lose weight na beboa.
And I think you've said everything. At the end of the day, when it comes to loss of weight, and young doctors here advocating for loss of weight a lot, and sadly, women have a higher risk of increased weight, especially during menopause or after menopause. And second disadvantage, I of black origin, I want to say, by nature, your weight to know you're high already. What's your more body, or more nyama, bemano beka, omukra nyama, like fat tissue never around them, are very high. Now, disadvantage, yes, because of that, more risk to some kind of systemic diseases. Just problem no any about weight nankasao. The incapability now weight to be cause yamam. And so the imagine say you've been building a house for and I will build a house for the past 10 years. So pillars now if why a pillar for one floor? I feel what the second floor account it was a pillar, first floor, only first floor pillar no so at the NBC definitely a bear too much weight for the pillars and the pillars cannot sustain, and that is our major problem sometimes I facing in our communities. Yeah, me for and then as if we be brave knee problem, hip problem, any simply mainly because sometimes their body since has been built for accommodating a specific weight, but with time increases with especially during menopause time because they are high risk to increase weight increases weight now because the idea was said that is made to handle only maybe 1 kilo now has to handle twice of whatever is handling, and it is not feasible. And sad thing about increased fat, and I said fat grow baby out, and the more you grow the more your muscle must reduce. Just say idea your muscles boy yeah 100 say for your skeleton you cry and the more you grow, the more all those things reduce and give increased chance for fat to come in. And the my fat abba more. Now video idea was say and supportive fat and one can naturally reduce it. Into a banasana a body in balance but to be into when we doctors always preach about the importance of weight loss, sometimes like a layman person and in that field. A disease like diabetes, diabetes, and most of us will be in their family, they have 1 or 2 persons that they know that have diabetes. Just say in a way, we have a little bit of risk for diabetes. Say me Mustapha, my family me need diabetes, for example. Now Kodzo ne family more diabetes. Ne life I was so live, and yet the same thing, same life na was say me living. Say I was say ye ko chile ye ko restaurant wa de me didi mama hwe Kodzo say ma Kodzo nhwe me say me chile me didi say na chali fufu apayo yenko fufu party yenko benku party and na say for me living life my health does not, or my family history or Kodzo's family history does not permit him to live it. And the only disadvantage to that yet me treat BBL but problem ne say time no do na say obeng time of death and then as for say who ni kwa but who say na bibia na ebrabem till you see say our parents suffer a lot because disease is no a chrome, and all we can do is to reduce the symptoms. We can only reduce the pain, but we can't do much about the pain. This topic about weight gain, women and Kasa, they are at a very high risk of increased weight. They have to be very conscious about this factor. Time especially hormone, and then your hormones basically stable. Women hormones na akoye say ECG akosoro na abafo me kosoro na abafo enti balance na I was say oban ten ho ase enhwe nyama na ukura no kwa, like also be concerned about it and make conscious efforts to achieve better health. And for decreasing weight, Kodzo eka almost everything. Your carbohydrates no embwa. Adia, when it comes to loss of weight, the main advice that has always been given is I was say yendi balanced diet. And I didn't say social studies those there say RMU, minimum time we RMU. But times life and morals minimum you be saying question what is balanced diet? It is our balanced diet. When you question the definition, proportion of everything. That is the first factor when it comes to reducing weight. Reduce it. Like some petty things are you pay attention to it, but it you increase it. For example, obesity. or increasing weight, even psychologically affecting. Because otekono odwene ho and I dintiana me namfo no omo body nice na me de miyefo eso adintiana me de meso me de mintimi nyahwe. And so there is a constant psychological effect which a very important say you dwane no banku fufu yankase mamundi ba munte so munya conscious about it. Dia na wodwen ho say na 20 years time we yabeboa me ana. And I say Mr. Mundi fufu every night. Like you want fufu do fufu every night. And you're feasible in my system. And and secondly, he spoke about exercise. So person do fufu every time now, making sure so ube exercise proportionately. So dear now Johnny. Like I was say exercise needing to be proportionate when it comes to all these things. About health, general health, and even especially for women who are being almost a lot of stigma in the society. We won't say Bema de on shada found they will on looking on shada found, but obaye kesia kakrana hey bibi na hey. Nti I was saying, Bano, we are very conscious about your weight. And next thing, so and I said in weight decrease, no one factor you consider a psychological any adequate sleep. Mr. Remo, sometimes the night is made for sleep. As idea we make the night is made for sleep. It's a night no do amonda. Just say unless you have other activities, and I think the married men and women here understand the other activities I'm talking about. But say night no do. Let's have adequate rest. Now, idea me person me touch on another thing about Kodzo very important. And I said, I was saying, you having good sexual life. Now, good sexual life, no, as a and a very important question. Say, good sexual life. Research be actually say good sexual life, no. It me boa when you be. For example, say a good sexual life. It me reduce it. Yes, say research who say no ejaculate 20 ejaculate every day. 20% decrease in prostate cancer. Realize also say women have a higher risk of migraine. Realize say good sexual life it make you 60% of migraine. Indeed, say sometimes having a good sex it me improving nyama bebre. And it me creating a good emotional bond between you and your partner. And again, good. These are the importance of good sexual life. No? And again, good sexual life. One very important thing, an understanding between the two people. I was saying, sana kujuka ya munye feedback no mumbisa ekoye ekone sana na openana and it shouldn't be the usual okay bema meba bedaso papa na meko emboa because to be able to achieve the benefit of good sexual life I was saying respecting the laws of good sexual life. See, for example, a skin to skin contact is important. And yet, touch yourself, like feel yourself. I hope say a little bit of the mekanase. We are all adults in all right to reserve. More feeling my body because when we touch each other, you will be a friend of hormone of love. It's a hormone of love meeting koso. The hormone of love no koso etimi ayare be brave. Intiana ya mama for any ya papa for advice ye de bia say the young ones yenya na yan worry inti and to avoid all the diseases Kojo can about STDs and then as if one more having good partners, then young understanding when it comes to sexual good sexual life it may reduce a lot of diseases and risk factors any and so on. And this is the little thing I meet media Kadia Kojo. I can also that's it.
Yo, Dr. Mustapha and Dr. Kodzo Asamany me damunyina asi ene enwumre ewo enchechira mode amayen efa eye emma empomuden eho mwaka ensem bebre me dane me ho afa nkrato ba ku mienu me bape mema amanfo ho kwa me se Theodora ne ama edikan mo nsa so kra dada na afi mama nkofo ho kwan na mo so edi questions aba and the producer Pacho mami 2 commercials eno na chino yebema question time no atwaso
Mr. Mankwa me office was any skabanie de awie ni project no eso de bia me office ka mane wo problem
enemremu na monte tap send nka
no so ne de
tap send dey easy fast and secured way ubetimi send sika free amanone aba Ghana bank account and as a mobile money account untia transfer fee bia
sa awo be ne say
chire ne say won ko App Store na Play Store on download the tap send app no or download ya ebebusan so promo code o ma the pet TV shim obenya €5 £5 and answer $10 on his first transfer
ene me kwa friend aka akire
tabi minyanwie esanse tap send at the good news aba tap send the gene customers wonti or the tap send wallet aba
no be any say
so your customer wo UK sesia ubetimi akọ tap send app no no create wallet wo so enti se rate ne kosora now the sika kogu wallet no anase mpo ubetimi atususu nkakra enti abre sema opeso send sika ba Ghana no anse wa send sika na ba Ghana anase oba o my Ghana mu what me use sika e wo wallet no tie
and you said to say you use momo Ghana hayru
sa pepe se tap send that trainer shim kopiem wo United Arab Emirates Netherlands and Austria tap send now papa no
buy an interest-free home and pay within 36 months. Yes, Daimler Homes' new gold standard development, Hilton Court, has just commenced, and you can own a unit now and pay within 36 months without any interest. Starting at 95,000, you can own an elegant apartment, and guess what? Discounts are available from now till end of May. To learn more, visit our website at daimlerhomesgh.com or call us on 0200 584 558. Daimler Homes, the elegance of living.
Hello, this is Lawyer Wisdom of Wismart Solicitors. Join me this and every Friday on OT TV from 8 to 9 p.m. for all your UK immigration matters. I hope to see you there. Thank you.
Yo, Abuja for yes, I am Aquaba Bimu Edo Eba Aye OT Media TV ene enyumre Jumedie no aye time tap send ene kita yimu ema yetimi edi Jumedie ebro eniti baby bia wuti en wo hwe no me say wa say won download the tap send abomodian na download the tap send na won so nam so fast send sika koma abusuafo ewo oman Ghana munitichi yo ene enyumre ye kan about women health na said the doctor and say ema energy nso ewo fie so te ase ema empaso agro nso eyede eni nti ase yetimi ema eni egie ewo omo apomu eden eho ensem eno enane doctors omo adjoining Dr. Kodzo Asamany and Dr. Mustapha omo akasa afa sexual reproductive health ɛho asɛm, emotional and mental health ɔmo aka ho asɛm, family planning, pregnancy care, prevention of sexual transmitted diseases, waka about inability to hormonal disorder, waka ho asem, omaka ensem bebre, breast health, waka ho asem, mental health, waka ho asem, and it is sabri or question bia efa ene de omaka ho asem, another any general health question bia need to efa ma ho ubetimi ede aba, oka monopos ho asem, eno no eno kire se edu baby a mema no eze musua na mu invest in enioma bi yebeka ho asem. Yo, o question bia ubetimi ede aba. But Yamfa Tidora indica. Tidora, but you unmute yourself na for question, bra.
Okay. Madam Asibebre. Me pacho me so me question is say me kunu kan sembi na to metrimu no. Me na
Tidora.
Me di ya already me de che no.
But I also cook and sembi na udi ya but your na etiko kakra. Ubet me.
Me say asema o kan ye to metrimu no. Meja manaka ba ye me ya and I me so meja manaka. But then affecting me self-esteem. And so at some point of your life, you know, I like the fact that or supporting with you helping me around by bam pema. I'm not happy. I don't even have the edge. You know, and I realize say me libido na kasakran so I don't really have the edge at all. Inti I no so complaining say also have sex or ye bema ebeha no ni ade the fact that bema so was also to me ye and the fact say me so me happy, you know, and maminya sa dryness no so because say me ni edge no ntino I don't even want to even go into it at all. Intina me bisa say bibi say no edro pain na ana say ede ade na metumi aye aboa me abo no so because I don't know what to do again.
Okay. Tidora, thank you very much for your question. I think first of all, before in medicine itself, before you even think of say a draw, introduce a draw into your system and in you start from without medication. You have to have an open conversation, like I spoke about, and you have to have an open conversation. You sit down with him. I don't know whether you people have already done that, but I feel that is the right channel where both of you sit down, so you know that there is a problem. So you sit down, you discuss it. There is an understanding. Then from there, you move to the next. Step. What is the next step? If it is coming to the medical aspect of it, I don't tell people what medication you should go and get, because if I say it here, so I don't advise that. When you go to the hospital, some of the things that they might probably start from is your lifestyle and then your behavioral changes, healthy lifestyle. Some of the things that we're talking about, your exercise, your things that you can actually do to improve your overall energy level, eating good food, open communication, like I spoke about. Then these things can actually improve intimacy. When you try that and it doesn't work, and then you come back, when you go to when you come to the doctor again, they might probably probe further and then do some investigations, laboratory investigations, where they can actually do hormonal investigations. They can probably check your estrogen, or they can even check the testosterone. I mean, both people, the two of them, it depends on who is actually coming from. So they will do it and then they will check, is it low? If it is low, they will introduce to a hormone therapy. But like I spoke about, these hormone therapy also have certain risks. So they will discuss everything with you. Then you make a decision that this is what you want to do. So please, let's start from home, in the sense that, okay, you admit that there is a problem. You sit down, you have an open communication, like you admit and say, oh, they are channel, but it has caused you to have a low self-esteem. And after you're done talking about it, what is the next step? What can you actually do? If you are not ready to go, like, take it from me, start by improving your lifestyle, exercising, eating good food, improving your moods, overall moods, and then energy levels, and then all of that. Give it a try. If it doesn't work out, go straight to the hospital. And then when you talk to a doctor, it is always best. I don't like it when married women actually walk in alone. I just believe they should come in with their partners. So when they are telling them, because sometimes to me bad doctor na casting then you go home and it becomes a different issue. So you go with your partner, then they explore the options. You do investigation. If it is hormonal problems, they will put you on the right treatment, and then you see there are several medications that they can actually give you to improve your libido and then your sexual life. So let's take it from that steps. I've given you like 3 steps now. So try that, and then let's see how it works. The last resort, if you do it at home and it doesn't work, I'll just go to the hospital. I don't know if Dr. Mustapha will add something to it.
Yes. What I can add to, you've said everything perfectly right, but the medical count is apart from talking about it, and only the most important factor was say muka ho asem na montimi discuss say adena AC, e ma me feel say. And now after ye factor not from there, I was saying going back to the basics. And now more first time and now what did we used to do? So go back to the basics and try to find the basic things now, the petty basic things now that probably made you fall in love or decide to marry your husband, and the basic things that you used to do and now he used to do then that you really enjoyed. And the last thing I'll add to it is that spice things up. As in Yankushia, also additional techniques, and then as for like we learn from materials, and then Sena Kujokayan, the Sanyama 2-way account, apart from talking, going back to the basics and spicing things up. I'm sure it will go a long way to help. Thank you.
Mame Comfort Sego want to make a contribution to the Amoka is here. Mama Comfort, Yamfa, na enona chiname Yamfa, Mamma Masewa, so. And the comfort you.
Hello.
Hi.
Yeah, me contribute to kakra. Said the doctors minuna kano. Na me pesa me dwell a bit more on discussion about exploring what the main issue is. And you know, so few so on to me in discuss here. Onim ni kunu adam fu bia na se busuani bia ofere no a womutumi obetumi abem bia na so explore no womukwa sorry ananse womufre nyame se bia womu pastor ananse church leader bi o ha onu so esese obem. The other one which helps is sanipako we UK ha GPs uko GP wa womu wo counselors ni adia help with talking therapies. Into talking therapy no abetumi a start time anu kunu ni fie na onu nko aminim se nkwala wo ha onko hye dem na onka ade anu kunu ye no ombie na no te se de obi itie onka so oka che nyankopo ombie na no onka ni nyina manem emra out obi entie no onya se wabodam, but if you kind talking therapy on kasa bibia de nukuna ye bia aha no onka ni nyina na enfri no mi ebi so ha ebeka cho say true ni nyina eno so boa nti no apart from the doctors na kanu say you dwell more because said that na kwaye no enye nro nye hormones asem kra affecting hormones no, but as I say ebia it's not me feel say it's not fair on the husband, so onim se bia wa ye no boni bi nti no ese so tumi ne discuss on tumi a on frɛ obi na omeka ho no omo enkasa, because sex in marriage is very important. So one yesa na ekodru stage bi na so kohu oba bi a na ni kwaje no ho a na ade ne beje nsem. It is important say talking therapy no any discussing it in detail with trusted friends of the man, or a trusted family member, or a church leader. You have options. And a talking therapy. Say it. Would you before crown one or share demo? Can you before bibiana out? You'll be surprised how free you become after you've done that. And see, this is what I wanted to contribute.
All right, thank you. I think you can also, if you have the means, you can probably just see a therapist if that also works. But I mean, when you go to the doctor, I mean, the doctor might probably also suggest that you should probably see a therapist. So.
Yeah.
Okay. Right. Yeah. Yemfa amasewa and so and to aso. Ama yetio.
Good evening, everyone. Thank you for a very important talk on women's health. Nana Kwame, hello, sister.
Amasewa mehu pa.
You share Saturday, no good. I really appreciate what they've done, but when you talk about women's health, I'm going to contribute, and then I'm going to go. No, before I even contribute, can I go to Theodora's question just to add up to it, please?
Sure, go ahead.
Being a woman and being with women, because I'm a midwife, I notice a lot of things happen to women. But I just want to encourage you, because the doctors have said this, and then Auntie Comfort too has said hers. But I want to add this to it. You need to liberate yourself. You need to talk about it. You need to pray about it, depending on your faith. Very, very important. I'm just saying this to you because of the experience I've had. Yeah. When you bottle all these things in, one day you'll be in cancer. And I'm just being honest with you. The pain women bear in our lives really affect us. Yes, what can the amana? And when you talk to marriage couples now, they will tell you. But to liberate, I want you to liberate yourself. Don't let it be an issue to an issue affect your life. You can set yourself free. Pray about it, and then get how do you call it? A Christian or faith counselors just to advise you. I would say keep friends and family out of it, based on my experience. Keep them off it. Get an independent counselor. Speak to the person and then make your decision. Number one. Number two, please, very important, I'm telling you from experience, take things out of you. Try and then forgive. Yes, words are powerful, words are painful, but it will not get you anywhere. I know I'm a bit tough, but I'm talking from experience. Please find a place in your heart to forgive and then move on. Okay, thank you. So I'm going back to my contribution. I like everything the doctors said, but I would love them to really place emphasis on lifestyle and diet. Yeah, because it's a very important part of women's health. Yeah, because and doctors can be about lose weight. Yeah, and you know that women are prone because of childbirth, because of our busyness. We always neglect ourselves. And I will want them to just really talk about how, because a lot of women want to lose the weight. Weight is not a good thing. Weight is not a good thing. So what are the practical ways? I want you to dwell on that practical ways women can lose weight. And I would just base it on lifestyle. Yeah, because the lifestyle of a woman will need to change. And the mindset, and I think most Ghanaian women are put on weight now. It's from our men. Because our men want women who are back and front endowed. Or baby to get that fat, and forgetting that the fat that the weight that they are putting on is it can just harm them in future. We need to change people's mindset about weight gain and then lifestyle, the food we eat in this country. I have noticed that a lot of the Black community, have got diabetes, have got high blood pressure. We need to sit back and look at it. I tend to just look at what it is. And when you look at it, it's more or less our food. The carbohydrate is too much. We eat a lot of carbohydrate. We eat like fufu powder. In this day and age, when I hear people eating fufu powder, eat fufu and then it's the powder. I just really, because there's too much sodium in it. So there are a lot of things. There are a lot of things which affect our blood pressure. People say, "Oh, yare waha." Yes, yare waha. But the point is, we need to look at the foods we eat, everything we do. Our lifestyle have to change. And yet, the BN is a call night duty. I heard one of the doctors was talking about night is meant to for sleep. Yes, but the point is, it be a night duty, So you need to just give us a practical advice. I think I have to just stop here, and then I'll come back later.
Kwabnefro. All right, cool. So doc said na all kano ebinumu eye adwuma anajo enti ona ono so ye adwuma anajo no, what would be your advice for them, Dr. Mustapha?
Okay, thank you. First of all, for example, I was Switzerland before Bakwakoyi adwuma anajo I was a checkup because night works gives you an increased risk for having some diseases. Research about 10 reduce a constant night work. It may reduce about 10% of your life expectancy. Nti o steady for no per night work, but before no, because of additional bonus come nti bebre coach had me night 12 hours na ba me buy double of the salary and in for, but a slow poison who slowly, because so we night work. I say unya hypertension at the age of 50 probably at the age of 45. Inti sena okay na pepepe. The night work no se mo be yimpo moon limited. Today we are fit, maybe are you okay? But in 10, 20, 30 years to come, ABC. And the Obisa, a very important question, which is the practical way of losing weight. Number one, Nadia Mimi who say very important, the intent of wanting to do everything necessary. She said, why you wondering say, and was say me lose weight to Kianeki. And it's very important, fundamental. To say example of my Number two, who make intent in we are. It was setting small achievable goals. Just say, say this month, the person me lose 1 kilo, and the goals have to be realistic. And that down, and catch was a woman lose 10 kilo. Yeah, and you know, I want me lose 10 kilo. I just say, yeah, being actual one. I was say yes, setting achievable goals. Yes, set achievable goals no we are. Now video, share say a plan that. For example, African homes, you need diet plan. You need if you are near a family baby on Monday, Tuesday, Wednesday, Thursday. There is no plan. Just say, yeah, bye, okay, at the end of meeting, I end there. Oh, me kunu at the end of person there. Oh, me could like, and that's that we are used to eating what we feel like eating, but that is not the case. Udru age beer, you have to eat what would make you live longer. It down carbohydrate. I think the weight loss be a huge topic. So you see about discussing into details. I just say you pay another way you're discussing, but make the intent, set the achievable goals. If you have to see a dietitian, and then finally reward yourself for the little efforts that you have achieved, for little milestones. For example, so say by the end of the month, so lose 2 kilos, no to me lose 2 kilos. Reward ye bibi ma ye bibi nema appreciate your effort. So appreciate your effort now. I'll programming to do more of these things. And but with time, we can talk about the different diets and how we can plan that. But these are my ideas.
Yo, Dr. Mustapha Medasi, Dr. Kodzo, is it advisable to do IVF if you are pre-menopausal? But you are on mute.
Oh, sorry. Yeah. In vitro fertilization, that is IVF for people who don't know. It is often considered for women who are actually premenopausal, particularly if they have issues with, if they have challenges of the natural way of conception. And then nature say, or try so warning can say. That is when we introduce the IVF. But however, it is advisable, say, it depends on many factors, including your age, ovarian reserve, I think your overall health. When I say ovarian reserve, we know that the ovaries play a very important role in conception, in the sense that ovarian reserve, it refers to the quantity and the quality of the woman's remaining eggs. So these, it plays a very important role. So some of these, they do an assessment. When you go to the hospital, they check something called the, I think the AMH, something of that sort. They check it and then they see the level of it and then see what is the importance of this, because at diminished, if let's say you don't have, let me say, if the eggs are not quality, you don't have in quantity in premenopausal women, it can affect the success rate of the IVF. It can actually affect the success rate of the IVF. And then also, when I spoke about the age, impact on fertility, as you grow, the rate at which you become infertile actually raises, because only and then your overall health, medical conditions, different pre-existing like diabetes, hypertension, and then all these things can also impact on IVF outcome. So yes, it is. But then before we do all these things, before we implant, we go in for the IVF. These are some of the factors that they will probably go through and then check whether it is advisable for you to take it. And I say it's advisable for you to go ahead, because if there is a reason why we shouldn't, they would actually tell you. And I think there are other things that they can actually introduce to you, or they might probably advise you to do if all these factors don't work. So I believe, yes, often it is advisable. Then they consider some of these factors. I don't know if Dr. Mustapha has something to add to this.
Menopause yenka weipa and twaso enka obi say men pause. Menopause. All right. So on that note, there's this question: in terms of men, will a woman ever go back to feeling normal again once they hit this stage? And if so, how long will it take?
So like I said, it's this question is more like and you are still expecting say your age will decline. I mean, untimi 50 no akasa was about bede ebedi 10 years and now 15 years. As time goes on, some of the things that can actually happen, so some of these symptoms might decrease. Some people may never experience these symptoms that they experience, like these hot flashes and all that. But then I think the majority of the women would just have a decline in it because you just have to manage it. And it's more like a lifelong, just like diabetes and then what's it called? Hypertension. And maybe the moment you get there, you just continue like that. So naturally, when you hit that stage, we can manage it. And then after some time, after some years, you realize, hey, it's me from like you never experience some of these things again. But yesterday when we spoke about menopause, we spoke about osteoporosis. In we'll hit to menopause stage now, you are actually at risk of having bones in the and so the moment, what I would say is you pay attention to is the fact that the moment you start having obitimis and in 9 don't pay more and then all of that, those are the serious things you should probably pay attention to, other than these symptoms like hot flashes, those ones you get used to it. But say when you need don't pay it is very difficult to actually come by, and things to actually maneuver your way for the person to feel better. After your operation at that age, you might not want to go to under the knife and account. So I just want to let the person know. So, I mean, when you hit that stage, we can just manage your symptoms. Some people may never experience it, but it is likely say that you will experience it, but the symptoms will be very, very minimal. So yeah, that's what I have to say.
Just to,
all right, go
just
ahead.
to what he said, I think a question is tricky, Kakra, because when you feel normal again, a menopause normally is about when you will start adjusting. Like time frame Ben now be to me adjusted to the new things that are happening, because hormones now that have been released in the past, and you be releases this year. Some people adjust in 2 years, some adjust in 5 years, some adjust in 3 years. It's like with time, the woman gets to understand herself and she gets to understand some of these symptoms, so she's able to adjust adequately to these symptoms. And as Debia Kodzo advocating for, you should be conscious about this period when it starts and make more research about it, see the professionals, and things like lifestyle changing and stuff. It me mau adjusting them. Nkrofobi it me take like 5 years to adjust, but nkrofobi take a shorter time. And with time, you should pay attention to diseases like osteoporosis and all kind.
A quick one: is it okay to have sex whilst I'm pregnant?
Why not? Why not?
Okay. Will health benefits be? And I say normal feeling na you're busy in India.
In layman's language, in layman's language, what is yet to be to make us say it's a form of exercise. It helps the woman, I mean, doing childbirth and then and then all that. But it gets to you. If it's a normal, there are some complications. There are certain things you can't be having sex with the woman when it's a complicated pregnancy. That one. But then sometimes, I think today, I don't know, for some funny reason, I came across something on social media where someone asked a question, say, once it hits the baby, if you are inside the woman, no, the baby is even safe because the baby is in a sack. So it is very difficult. I don't know. If you are manpower, then I don't know. Say, but I mean, you can actually go ahead.
Yes, let me add up to what Kodzo said. Protections are a dawson. Indeed, manpower no a banner saying cry now. unless woman and kasano the cervix may be or you're at risk of having a problem. And yes, our woman power near saying going to be penetrated because at the a cover and sana you go and meet the womb cry the way I develop one share yeah didn't be to me like I mean you the man momna because of the protection that has been created for the woman no Okra no be to me have a complication, but it should be slow and done with love because the major advantage that it brings is the emotional connection and the stability that it brings. Because that communicate emotional connection are you and your partner are more having. The baby is also getting that emotional connection as well. Indeed, helping in releasing stress and for Senameka, about this issue of pain, and then I say for a good sex with orgasm, it me releasing pain. So at that time, is even advisable, just that it should be done with care and with a lot of connection and love, and not about more of a beja idea.
Ye vieja. Yo, mamin ko anti-comfort na mafa amasewa na fe ba Dr. Sewa no ne wrap up ne enwumre na ye the conversation no asia. Anti-comfort mbacho ye tio. Anti-comfort wo ba me when it comes to sexual health we are the pregnancy period no, is there any sex position here with me advice mbacho take it na ye into aso.
And I
think comfort.
Aye.
Because I'm the media names happened.
But you're the meeting my canvas.
Me that's it. Okay.
Anti-comfort and Kaza.
I was muted. I was saying that I'm muted.
Yeah.
Menopause. Dr. Asamany Dinhujuma Papa Panti, it's a shame say Nkrofo ama metie. Naka kakra about hormone replacement therapy. Bibia aba before no we are not assessing it. There are a lot of research about it. Na Nkrofo so mu yuso mbenya cancer ni ade. Yeah, it's true say one more years our research no there were some proportion of women be a one nya, but one go deep no mu say a familiar just a one family mu. Enti no say a base well-being human hormone replacement therapy plays a very important role. Now a lot of abrofono so their general health has improved, their general well-being has improved, they feel happier. And said the doctors in a car, you not go back to your normal position because you are growing. Yes, we are age, but you can also do things apart from what they are doing. You can also use HRT to improve your mood and your general well-being so that you are happier and so on. I will recommend, say, if you are menopausal, go and see your GP. It's individualized. One more risk assessment. If you shouldn't take it, they will make it clear. So because of this history or because of that, you are not eligible for it. But there are other before who are eligible, and they should be encouraged to use hormone replacement therapy. In turn, and person will contribute. Coming to the positions during pregnancy, I think it's individual. Obiani positions are or feel comfortable. Position abemu feel comfortable. So if you say so worry for a man no how to do it because say especially if you na yakasia.
But how are you? Anti-comfort you so hard worry into.
Worry. Drew Obiana say if you are comfortable and you are allowed to have sex because depending on the state of your pregnancy, make I say, me training colleague, there was a doctor be near friend, no baby, no home. So pregnancy na someone who are beju to hospital, kwapem tama, ubenya 9 months na obewu. It is a same be any pregnancy no dia, na so fear. And when you can discuss the position, I'll be feeling comfortable with, adopt that position. Then you see him say it will be difficult for you, so be from the front. And set the position be a comfortable amount. Just go ahead with it. That's what I would say.
Yo, ebedasi. Ma yemfa amasewa briefly na wrap it up. Ama etio.
Okay. Sorry, not mean to me on mute. Yeah. About the menopause question. As it's been said by Auntie Comfort, it depends on an individual. I had a very bad episode of menopause. It took over almost 6-7 years for me to get a bit better. I had it badly because mine was medically induced. OBIS no OBIA. But one of the things I would just advise people to do, I couldn't take it, but evening primrose does help. I couldn't take it because of my conditions, but evening primrose, yeah, okay. And then make sure that you are up to date, especially you are up to date with your vitamin D levels. And then make sure that you look after yourself. You change. I mean, it's been said already. Lifestyle changes can help. Rest more, and that helps to just overcome menopause issues. And if you need to talk about it, talk about it. One of the things that men say blacks, and say we don't talk about whatever is going on with us. We always just keep it to ourselves, and it doesn't help. But last year, I don't know on the news, BBC, if you heard, they were talking about menopause. It's been a long time that people don't talk about menopause. And menopause, sometimes you become suicidal. Sometimes you feel like ending your life because people don't understand you. And it's a very, very time. Yeah, I think women need all the support from their spouses and the people around, because you can't talk about it. Because we don't talk about it, it does affect us. And one thing, yeah, because when your mental health issues, one of the things I would just advise is say, if you are going through menopause and you are not coping, please, but you need to just really talk about it. Let your GPs, let the medics around you know the way you are feeling, and it does help. And then explain to your spouse too, because it's quite difficult. Winter, not my windows were open. My husband was like, "I'm cold. What are you doing?" I had to sit him down to say, "Okay, Daddy, Kofi, this is what and what and what." And he did understood me. So we have to strike a balance. And, it has to be discussed in the family so that people will know what you're going through, so that they can actually give you the support that you need to go through that stage. Thank you.
Yo, yebedase. Oshe eneya utimi say generally doctors are touching on so many topics. Ese yenya time near picking on mako na yetimi ehwe ehon asem eka. Oshe said the menopause in ho asem iko ya na just say hu hia ema no pa, and we will still you find it a very convenient time now you picking some of these topics. Doctor, mame emfa we na fi yen wrap it up. Or say, does vaginal discharge means something wrong? Does vaginal discharge means something wrong? And at the last one, I made Ebeka Hono, so or say, if I have pain during sex, is there something wrong? These two questions. But you'll be answer back, mommy.
Mustapha.
Yeah, I'll see me choose the choose first one. No, why? I mean, vaginal discharge. It actually depends. You know yourself. You know the color of your vaginal discharge, your normal color of discharge, and you know the BB in most cases, a BB you would be able to tell. And the BB you observe things like color, odor, other additional symptoms, and then as so forth, because they might mean infections. Sometimes they might even mean that you are pregnant. They might mean other internal diseases, and then as so forth. So the best thing to do when you're seeing a difference in your vaginal discharge based on the quantity, the quality, the odor, the nature, and everything, the best thing to do is to, I don't know, mostly in the UK, AOGP, but for some places like ours, you have to see your gynecologist for a full examination and additional test. Thank you.
Oh, let me quickly add, Dr. Mustapha, that in the UK, there are sexual health clinics all over, and it's free and confidential. You will not even pay for it. Even if you're a visitor to the UK, you go to the sexual health clinic, it's free of charge. You won't pay anything. So just go, and then they would examine you. And then if they need to do some tests, they will do it, and so that you are reassured. This is just to add.
They're free, so they're that's the matter. So you're free, just go get checked out.
Confidential, free and confidential.
Free and confidential.
Yeah.
All right. I think the second question, no, the person wanted to know is pain during sex a problem, and that's maybe so. I think if I got it right. Yes. On a normal day, you're not supposed to, if it's not your first time, if you don't have any underlying condition and anything of that sort, if the person you are having sex with, sebe se neja padiano and so mbroso sa na se normal na se fetia eni se ya oyasa. But then again, it could be due to infections, UTIs. It could be due to hormonal changes where there is a decline in estrogen during menopause. You start having vaginal dryness, and you can't, and bisa say intimate, you see baby oil. I mean, when the vagina itself is dry, I mean, there's friction, and then you hit the person, so the person might probably. So you find your age range. Well, on that stage, but so we saw. Now, and yes, be a better manager party and this one. I say it's a rough activity, it's a rough thing that the person is doing. You are supposed to have a smooth sex, and it could be due to a condition called PID, pelvic inflammatory disease, and also so the moment I'll just say because of time, I'll just say if you are having pain during sex. I am answer why you don't have any pain, you don't feel any pain, then all of a sudden you start feeling pains, then it's a cause for alarm. So you should go to the hospital and then probably go and then find out. Like I said, excluding any vigorous activity, because young boys your baby babas no mu plan mesrel and the wow fault and it is only the wow fault. So just go to the hospital for them to find out whether there is any underlying condition, and then you'll be fine.
So just a quick one, Dr. Mustapha and Dr. Asamany, the moon can so say Emma, we are different from men. Into Emma electric cookers. And my gas cookers. It takes a long time for us to get to the to wherever. So we now making sure say we do certain level be and son our penetrating. Yes, she will not enjoy it and she will just experience pain. I think that's also very important.
It is very, very important. I always say that sex is an act, and for your act to be very beautiful, you really have to take your time to bring out something very. So if you really want to enjoy it, you have to put in the work. Nothing comes easy. If you want to enjoy it, and if you want the lady to show you what she has, please take your time, and then you do the necessary, and then you would enjoy it.
The lady who asked the question, I think the first thing you can also check out for is the man making you lubricated enough? So probably the problem is the partner no need to wasiana we there on shedding need more trigger points, and then as if when say zana so kind or say it takes time for you to get to the promised land, and make sure that you don't allow someone to come to you without you getting to the promised land. Thank you.
Yeah, the other thing is about infection. Sometimes you will thrush their friend white, who say oba unya a cow. Now a man so be to me say a cow utitia na de pa, but kaisa utitino a cron kitten bebaho. Intinebia or refi so when you're white. Now what it one there. By all means, one a bemanishia a beya. and yeah, that's the point. If you say be how, just go to the sexual health clinic. So who are you there? It's free. Now one more examine or no one can it's better.
They are Dr. Mustapha Boni Trinko and to comfort. Me say next week here sexual health topic.
Then I say, yeah. I was saying, in fact, to go for a special advisor. So go
me said the air quality the doctors munina mwaja to say nyame boa next week here sexual health.
Amen.
Yes. Amen. No, but I my menje mo last words. Na enka me question me bebusa na me reserve na nyame yad ma next week mebusa sa question no. It my menje mo last words.
A personal question Anna.
Oh, there be any personal in general.
Maybe that question Anna, because there was a question I think Tudora asked something about can someone experience symptoms of menopause at the age of 30? It's rather unfortunate. I'll plead with Theodora. I think we have this thing every Wednesdays where Dr. Akusha is the host. So try and don't miss it because there are a lot that is being said. Because I said all these things yesterday. You can be having thyroid problems and it can be mimicking the symptoms of menopause. Sometimes I'll call hospital, they will tell you to do a thyroid function test for them to rule it out. So you can be having something like that. It could be anything because these symptoms are just general. It could be anything. So when you go, they would actually do certain tests and then rule it out. So please, I encourage each and every one of you here to be joining the Medical Talks show with Dr. Kodzo and Abena on every Wednesday, 8 p.m. and then you'll learn a lot. Yeah.
You said the doctors Wednesday, like every Wednesday, we do OT Health Talk and into Bomodiana joining. And yet, just the topics in now any general health condition, and I say question be will be an oba doctor what show no omo eboa you are no Emma Aquanchre and into Mr. Moa link now the by year in Nyami this Wednesday 8 p.m. Bomodiana ni Asia. Now said here Dr. Mustapha Jatuno next week on Time with Tap Send you be health sexual health topic sexual health or belha yo I was for Ahano.
Me patrol last one. It was for me patrol because host Dr. Akusha Abena. I mean they are the host. So if you have any questions or if you want to find out about anything, I've just typed their page, Facebook and then Instagram on the chat, so you can actually follow them. And then if you have anything, you can probably ask them, and we'll probably follow up and then we'll see what we can do about it. Thank you.
This one there, I would end up with a little joke. Before I traveled to Abrochi, I'm share for movie. Then Biana, I'm sure I'm on like you see them walking low pace now, more parks, no more antenna to a park or so mentasi. One day maybe I say I'm broke for Umunishi Yana. But maybe drew her. BBC way to go and I'm here because I ended up finding myself on the street walking just like the boy nowhere. So just to let you guys understand, take your psychological health, very important. Sometimes you need space. Go out for a walk and get good health. Move, my people, please move. Africans, let's move. Young. Fine. That's what I can leave you with.
And lastly, please, the women need our support. So support our women because if they are happy, I mean, everyone will be happy in the community. So please try as much as possible to be with them. Give them the maximum support that they need throughout their natural transition until whatever that happens. Thank you very much.
Man, let me quickly share something with you. If you treat your woman very well, if you treat her well, you don't have to ask. She will just go down to you. You wouldn't have to struggle with anything. So listen to these two handsome young gentle doctors and do as they are saying. Treat the ladies well and you won't have to ask for a lot of things. They will just melt down for you.
Yeah. Apo. Yeah, that's what
Apo kron. Yo, I was there for Yabeda Muninas. Nitichu, yen special guest, Dr. Kodzo and Dr. Mustapha Mbakai, when you marry and you train Komo, if I apomode. Docs, Yada Muninas Bebre, and I want to be joining Emma Enejumedi Echo Ye Pano, Yada Monso Ase Sabre, Yadani, and we are bar a tap send focus section, section where you be a breakout room, a honomo and a customer service team, no, ebe honomo, or any particular issue with your tap send account, go to breakout room 1 na customer service team no emboa sa and so any general question and answer suggestion contribution towards tap send no so no ubetimi e dey aba our main platform so na me kai say nyame aduma next week ye be share on the health talk no Wednesday, Thursday, tap send focus section. Now this Friday, so ask the lawyer with Wise Smart Solicitors. Into any share the same link now the buy na any share nyame admuch na and also Wednesday na afi yasan share mubium on Thursday. Me fan kratwe me ba ye be breakout room. Doc, me da munyina ase nyame sham bebre.
Nyame sham also.
Yeah, Daniel Hwaba. Name kai next week. Sexual health.
Mr. Mankwa. Me offer was a niska bani de awie ni project no. Eso de bia me offer sika amane wo problem.
Enemremu. Na monte tap send nka.
No so ne de.
Tap send ye easy, fast and secured way. Ubetimi send sika free amanone. Aba Ghana bank account and as a mobile money account. Untia transfer fee bia.
Sir, I obey ni say.
Chene se wonko App Store na Play Store. On download the tap send app no. Or download ya ebebusan so promo code oma the pet TV shim obenya €5 £5 and answer $10 on his first transfer
enya me kwa friend aka akire
tabi minyanwie esanse tap send at the good news aba tap send the gene customers wonti or the tap send wallet aba
no obey ni say
so your customer wo UK sesia ubetimi akọ tap send app no no create wallet wo so enti se rate ne kosora now the sika kogu wallet num anase mpo betimi atosusu nkakra enti abere sema opeso send sika ba Ghana no anse wa send sika na ba Ghana anase oba o my Ghana mu watimi ayusu sika e wo wallet num no tie
eni ese say use momo Ghana hayiru
sa pepepe se si tap send that trena shim kopiem wo United Arab Emirates Netherlands and Austria tap sender now.
No.
Hello, this is Lawyer Wisdom of Wise Smart Solicitors. Join me this and every Friday on OT TV from 8 to 9 p.m. for all your UK immigration matters. I hope to see you there. Thank you.
Yo, I was at Tabre.